Aloha mai kako, everyone. Welcome to the Moana Nui podcast. My name's Moana, and I will be your host tonight. We want to mahalo Papa Ola Lokahi for continuing to help us bring this podcast to our audience. They do such a wonderful job of connecting our Native Hawaiian organizations and really uplifting the health and well-being of Native Hawaiians. With that said, one of Papa Ola Lokahi's partners is Ola Mamo, and those are the wonderful people who we are going to have on the podcast tonight. Ola Mamo is essentially the Native Hawaiian health system on the island of Oahu, and we are happy and honored to be partnering with them on an upcoming Kupuna interview series, which has been so fun to work on so far. So look forward to sharing that with you guys later this year. Our first guest is Leah Leong. She is the Director of Operations for Ola Mamo, a Native Hawaiian healthcare system. She was hired to implement the American Rescue Plan grant in 2022, and she now manages all of the operations for Ola Mamo. She holds a master's in industrial organization psychology from the University of Argosy. She was born on Oahu and raised with Native Hawaiian values and beliefs, and she continuously puts her Native Hawaiian upbringing in everything that she does. With professional training, schooling, and experience in social services, both inpatient and community-based, she is familiar and certainly no stranger to the resources available and even the lack of them living here in the islands. Let's see. So let us welcome Leah to the show. Aloha, Leah.
Aloha.
Alrighty, our second guest is Dr. Alika Maunakea, who is a professor at the John A. Burns School of Medicine at Manoa. Go Bows. He received his Bachelor of Science degree in biology at Creighton University, his PhD in biomedical sciences at the University of California, San Francisco, and completed his postdoctoral at the National Institute of Health. He's been studying epigenetics for over 20 years, and he's developed and applied novel high throughput genome-wide technologies that surveys DNA methylation. I gotta know what that means, methylation, and histone modifications, and has discovered novel roles for DNA and methylation in regulating alternative promoter usage and pre-mRNA splicing with implications in disease development. As a Native Hawaiian scientist, he promotes diversity in the research workforce by collaborating with a cadre of health disparity researchers on various community-based biomedical studies while training and mentoring underrepresented minority students in multidisciplinary research careers, which is so important for our community. He also directs multiomics course under the Integrative Center for Precision Nutrition and Human Health, and is the co-lead of Pacific Ocean Native Observational Health Legacy Study, founded by NIH. Let's welcome Dr. Alika to the show. Aloha.
Aloha, my kako. Excited to be here.
Yes. And then last but certainly not least, Dr. Kevin Castle. He's an associate professor and researcher in the population sciences in the Pacific Program and director of the Community Outreach and Engagement Office at the University of Hawaii Cancer Center at Manoa. He has 30 years of experience providing cancer prevention and control education for cancer patients, the public, students, and healthcare. He has worked in Hawaii and across the U.S. Associated Pacific, conducting intervention projects that uses community health educators to improve the uptake of cancer prevention and screening strategies in medically underserved communities. He led a nationally recognized NCI Center to Reduce Cancer Health Disparities project that used a community health educator to promote increased referral, and accrual of Pacific Islander women for the first time to the tomosynthesis mammographic imaging screening trial. Guys, you guys got me all kinds of tongue-tied. He also leads the Kuola project, supported by Ola Mamo, that promotes colorectal cancer screening in Native Hawaiian men using cultural practices. So let's welcome Dr. Castle to the show. Aloha.
Aloha. Hi.
Alrighty. Well, wow. Just reading those bios and doing a little bit of research beforehand, it is always amazing when you see Native Hawaiian doctors working in these spaces and particularly working in our underrepresented communities because there are a lot of nuances that I'm sure you guys, as being the experts in this community, that like most of what we think of as the like mainstream healthcare system, a lot of the research is not focused on our community. And so a lot of the guidance that doctors work off is not really tailored to like the unique makeup of our people. So as someone who is also, my dad was someone who passed away from cancer, and navigating that whole the end stages, and trying to see like, okay, how did we get here? Because it was like a late stage kind of diagnosis. And like I'm pretty sure he's not alone when, as being like someone who probably ignored the early signs and said, "Oh, I'm good and I'm Hawaiian. I don't need that." So, so thank you guys so much for being here tonight. So tonight we're talking about the new mobile clinic, so the Kuola Mobile Clinic. Leo, will you tell us like how that came about and how your Ola Mamo is working with both Dr. Castle and Dr. Monakia?
Sure. So we have two mobile units. One, we were able to purchase this through the American Rescue Plan. The Kuola one, the one that Dr. Kevin Castle is a part of, that's the cancer center one. That one was in the making for years, even before me. It was being planned out. Dr. Castle was there throughout the whole time, designing the mobile unit. It finally came on island last October, and we had the blessing last month for it. So we're up and going. For Dr. Alika Monakel, he's working with Dr. Marjorie Mao in the Pono project, and that's a different mobile unit. So that mobile unit came out in 2023, January last year. And that one was supposed to be geared towards the communities with our medical director. And we found that now that COVID has mitigated and some of the services that the doctor wanted to perform wasn't going to work out in that mobile unit. So we partnered with Dr. Mao and their team at Jobsum to do some Native Hawaiian research. And both doctors would explain exactly what's going on in there. And Ola Mamo is fully behind their researches, their services to our community. And this is exactly what we need for our Native Hawaiians. Yeah.
Sounds wonderful. So, Dr. Castle, Kevin, let's talk about you because it sounds like you've been working this for many years. Anytime we start something new, it is a lot of processes, hurdles, and things to get through. So, will you tell us a little bit about the clinic and your journey in that?
Yeah, well, thank you for having me and thank you for asking. It's been a journey. As mentioned, we had planned this clinic. It was a collaboration between the UH Cancer Center and Ola Mamo. We worked together to have the clinic built from the ground up. We worked with our Native Hawaiian physicians to actually get the components and features of the clinic to the specs that we wanted. And all this was right before COVID started. So unfortunately, when COVID hit, the supply chain issues, because the clinic was built in North Carolina at Matthews Vehicles, and we had it built to spec. And because of that, during the building process, it took several years for us. It was supposed to take about 6 months. It took several years for us to get the build done. But they were very accommodating with the build. They built it according to the cost that we had negotiated. And we had the features built into it. So it finally got delivered here on the island back last year in November of 2023 after being planned since 2021. So the mobile clinic itself is a full-on clinic. It actually has a clinical capacity to do medical testing. We can do sample collections. We can do specimen collections. We can store vaccines, those kind of things. But it has other features. The whole purpose of the clinic was to support our Kuola program, which is focused on Native Hawaiian men. Some of the key people that I work with, including Dr. Claire Hughes, who's one of a stalwart kapuna in the community, had noticed that Native Hawaiian men were often overlooked in terms of health services and health promotion, mainly because of a lot of different social determinants, things like work schedules, insurance access. So she wanted to have a project that was focused on Native Hawaiian men. And this was built out of her work with Native Hawaiian women being so successful. So the Kuola Project was born. This was over 20 years ago. But through that project, what we did was we worked to address the cancer related issues for Native Hawaiian men. And so from that growth, we developed this mobile clinic is the final or one of the latest iterations of that project, where we're actually addressing health in a total, a multi-sector, multi-level way. We want to be able to not only educate the men, and I can gladly talk more about Kuola itself, several components, not only just the health promotion and cancer control components, but the men. And the whole project was built upon discussions with men, and we listened to what they wanted and what they wanted to do. And they wanted the health promotion aspects, but they also wanted to do and preserve cultural practices and cultural traditions. And so we built that into the project itself. And so that's the latest feature about the mobile clinic. We can go on site, gather the men. We can do health promotion education, cultural awareness training, and actually go to where the men are rather than having them come to us. So that's the short version of, not really short, but that's the abbreviated version of the project and how long it's taken us. But it took a lot of challenges with the clinic itself, with COVID and the supply chain issues.
Yeah, so what I heard there that I really love is that which is what kind of got my attention about this, is that you're bringing the healthcare to them. And you talked about like work schedules being a challenge. I've definitely experienced that myself in terms of like healthcare, and also the insurance access piece, which is some folks don't have the resource capacity to get the level of care that they probably need for themselves and their families. So definitely love that you're doing that and incorporating the culture aspect piece, because for us that is such at the core of our communities, and bringing those two pieces together I think is amazing. So for those who like, is there like a specific community that you all service regularly, or do you go to different communities? How does that work for that?
That's a great question. So we go statewide. The project is statewide. With the mobile clinic, of course, we're limited to Oahu. But the idea of the whole Kuola program is to replicate the Halimua, the men's house, where cultural practices were transferred from generation to generation. So we built this out that we would go into specific communities and train the men themselves. I don't do anything. I stand there. I may take some surveys or things like that, but the men from the community are trained to deliver the intervention itself. So we have a person that facilitates the educational component. We have a person that supports the data collection. And then we have a Native Hawaiian physician on hand to answer the men's question, because we wanted to make sure that expertise was available. And we found that the men were more willing to talk about their health issues in the context and with groups of other men. They had that social support and they could build off each other. And that's how the project is done. We go to each individual community. We train the men in the community to deliver. And then we have several different, what we call modules, where we can do different topics. We do topics like fish ponds. We do topics like cordage development practices, pule for prayer, lung cancer. So different topics. So the men can be constantly engaged. And as they're talking and discussing these health topics, we're listening and we're hearing and we're changing and adding to the training components so that we can expand and enhance as we continue to move forward.
Gotcha. Well, I love that because it is a partnership, right? It's everybody shares the responsibility, which is very much rooted in our culture. So I love that so much. And I feel like with men, like it is important for men to have that fellowship amongst one another and that kind of that feeling of safety and security in safe spaces so that you can talk about issues that are you're facing challenges with that maybe other people may not understand. So to see this being perpetuated is awesome. I feel like when my dad was going through his things, that's probably something that could have helped him too. So I love to hear this. So Dr. Mauna Kea, it sounds like you have your partnership in your other clinic too, as well. That's been going since January of 2023. Will you tell us a little bit about yours and which communities you're servicing?
Great. Well, mahalo again. It's great to be here. Thank you so much for inviting me, Moana. Actually, we work together, Leah and Dr. Cassell, on many of these projects. They overlap a lot. One of the projects that we're using the Ola Mamo sponsored van for is what we call a new cohort study called the Pono Health Legacy Study. And Pono stands for Pacific Ocean Native Observational Health Legacy Study. It's one of the first studies, I think, really where we're trying to launch very grassroots approach to address health disparities, better understand and address health disparities amongst our Native Hawaiian Pacific Islander population. And we're one of 5 different sites throughout the country. So ours is the only one in Hawaii, focused on Native Hawaiians and Pacific Islanders. But there's other 4 sites throughout the country that are also looking at different subpopulations underrepresented in research and biomedical research, and also experience health disparities, and includes Asian subpopulations. So that's ongoing effort. We're part of this larger consortium initiative. Collaboratively, we call it the Mosaic Cohort Study. And this Mosaic stands for multi-ethnic observational study of American, Asian, and Pacific Islander communities. So Mosaic captures all of these different subpopulations that are typically underrepresented in research, including the Hawaiians and Pacific Islanders. So with Ola Mamo's partnership, we're really grateful for being able to leverage this opportunity with the van to go out to our communities, especially rural areas, and encourage participation amongst our Hawaiian and Pacific Islander individuals in the community to participate in the study. In the study, we're targeting 18 to 64-year-old individuals in the community, relatively healthy individuals, because we really wanted to understand what is health, what makes us resilient against disease, what sets us on a path towards chronic conditions, because we know our community is sensitive and vulnerable to specific conditions. You mentioned Moana, your family with cancer rates. There's higher rates of cancer incidence in our population, in addition to chronic conditions such as heart disease, chronic kidney disease, as well as diabetes, is which we focus on. And so we try to understand why that is. It's not just the fact that Native Hawaiians and Pacific Islanders have a higher prevalence of these disorders, but we also get it at an earlier or younger age than other populations in the state. And so we're really trying to understand why that is. Some of these entail these social determinants of health, like Dr. Cassell mentioned, broader factors such as lifestyle factors, education, exposures, poverty, food deserts, mental health challenges. There's a lot of different factors that can feed into these chronic conditions that manifest in our community. So we really need a resource to help us with better understanding the etiology of these disparities, why they occur at these younger ages, what's setting them up, what's causing it, the gene environment interactions that are involved. And that's really where my expertise comes in, trying to understand the molecular relationships between sort of the environment and the gene pathways that might be contributing to some of these long-term effects on health. And then we also need to do this within our population, because we realize that some of the strategies, recommendations, even the clinical sort of ranges of what defines specific conditions has been really largely biased towards one population, and not necessarily appropriate in ours. So we really need to understand for ourselves what does that mean? What does it really look like? What does health look like in our community? And how can we use our cultural knowledge and practices as well to augment some of the strategies that we know that can help us to live healthy? And so the van that Ola Mamo has is really a helpful tool for us to get out to the community, to provide health services, as well as encourage participation in research. So our approach to community engaged research is not just taking information and data and specimens and running in a lab, but really it's also blending in both education as well as resources, health services, best strategies, best practices, healthy living lifestyle recommendations and interventions, or linked to resources like Dr. Casal mentioned about physicians being brought into the community so that individuals that maybe don't have time or are not covered by insurance or have other problems with access to care can have someone that they can talk to and trusted by the community to learn about health and how to prevent some conditions in their families and themselves. So I think that we're doing research in a very different way in Hawaii, where Ola Mamo is really helping to provide us some of those resources to go out to those neighborhoods that typically are hard to reach. And we can provide those services as well as encourage participation of individuals in those communities in research. I come from a pretty rural area of Oahu, the west side. I was born and raised in Nanakuli, in fact, in a 4-generation household with my great-grandmother, who was the matriarch of our ohana. She was recognized as one of those Hawaiian Renaissance women, right? Knew all Namea Hawaii and taught us all of that. She was a La'olapa'o health practitioner as well. So all of the information that she provided just inspired us to learn about how we can live healthier by connecting to Aina and Aina-based practices and what that means to our culture and our people and our community. And she opened her doors to our community to learn more about that. And the irony is that within that community where I grew up in on Hawaiian homelands, right, we struggle at the same time with poverty, high rates of specific poor health conditions, cancer, for example, and a lot of social disparities, right? And so I think that we really need to have a way to reach out to those communities to encourage better lifestyles, but also to learn more about what are the community contexts that contribute to those conditions, and then also identify some best practices within the community, like what Mike Kupuna was teaching us about Aina-based practices, to really leverage their own understanding of what will make people healthy in their communities too, so that we can augment the sciences. So science, I think the way that we look at it from the molecular level to the clinical level is just some of the tools that we can use to bring to bear what are the challenges that we face in the community and how we can address some of those issues. But I think our community really has amazing ike and knowledge that can help us address some of those ongoing challenges. But the opportunity that we're discussing today about the van that Ola Mamo was helping to support is just helping us to provide that directly into the community and interface more regularly, provide the resource that they can see as their own, so that they can really better understand some of the health conditions that they're experiencing, but also inform the scientists like us on these best practices. What are the approaches that we should take? What are the things that we need to know about? Dr. Casal mentioned about what are the best practices or strategies that the men can use to help raise awareness for cancer, and how can we better intervene? My world, just like Mike Kupuna taught me, is like really, Malama Aina is not just a saying, like just a value-based system, but it's really practical. And the way that she taught us was a very practical setting, right? We were farmers. So understanding how to connect to Aina helps us to live healthier. And what that means is that we can actually help prevent like these long-term health conditions if we were able to identify those best practices that really are helping us to support our health, and then try to avoid or hopefully change some of the landscapes of our environments to be more healthy, which includes, for example, on identifying some of the potential exposures people might be getting that might contribute to these conditions, or even lifestyle habits that might be destructive to those conditions, and encourage better practices from our cultural lens in order to really avoid or reduce the onset of these conditions from happening in the first place. So the things that we do in the lab with blending the research really is enabling us to get to that point of prevention, I think, and using our ike kupuna really to help us move forward.
Yeah, that's wonderful. Aina is like center of everything, and like the more broader struggles that we have as a people with our land and our access to the land, that then enables us to maintain the connection, maintain the practices, maintain the traditions, right? Like I feel like we have all of these conversations. I'm like, yeah, but the key thing is Aina. So like, how do we get our land back and put our people back on it, right? So that we can have some better access to our ike kupuna and opportunities to practice it. In both of what you folks said, you guys talked about some best practices and tips and education that you're sharing with the communities. Is there a couple that you folks could share tonight for those who are tuned in and are looking for information and maybe they haven't heard about this particular resource yet? Dr. Castle?
Okay, well, yeah, I mentioned a few of them, but I think the best practice that we found for the men was it was basically getting the men together, having opportunities to get them together at times when it's convenient for them. We have our sessions in the evening or on the weekends. Ola Mamo has been instrumental in gathering the audiences that we need to identify and the areas that we need to go to. We found that for the men, unfortunately, they did not want to have women. And just like the Halimua, they wanted to make sure there was a safe environment just for men where they could share openly. And that was one of the things that we found, is that the men were more willing to disclose a lot of information if they felt that they had some kind of enclave and they had the safety to do so. And that was important. It was also important to build in for the men the ability to do it themselves. They didn't want outsiders coming in. They wanted to do or perform the behaviors and do the education on their own. They wanted to be trained and be able to take it to the next level and deliver the education. That was really important for the men. And then having the expertise on site, like I said, to have the physicians there, have someone that can speak authoritatively about some of the health issues that they were facing. And we heard a lot of things, and we heard a lot of things in different areas, depending on what the issues were. And it all, as you mentioned, goes back to Aloha Aina, having access to resources and having access to the land. There were some remarkable things that were said in these meetings that, really told us that we needed to shift our focus, not just in directly health promotion, but it needs to be in context of the whole individual, how important the spiritual, the physical, and mental, and they all blend together. And that's what we started to build into the project just by listening to the men. And it's important we're not really finished. I feel like we're just really scratching the surface of where this can go, because the men are telling us more and more about what they want to do. And then we're getting the response from the women as well, and how we can integrate. And that's the next step, I think, for us, is to integrate more of the Ohana and family into all of this, because that's a primary focus for the men. They want to be there and available and supportive of their families. And we use that as the vehicle to actually encourage them to take care of their personal health, because we found for a lot of men that was neglected. They just saw themselves as the vehicle for providing resources and sustenance, but didn't see how they are integral to that whole Ohana process. So those are some of the things that we found, particularly about the importance of just getting the men together by themselves to get in that group and have them have open discussions about a lot of different things. We go from things like talking about really sensitive topics like domestic violence and all these kind of things that are just coming to bear. Cultural practices, people are lamenting. People only want to know about this when it's time for something, bad to happen. We want to just preserve all the knowledge that is there. And unfortunately, that's one of the issues that we're facing. A lot of our kapuna are passing on, and a lot of those practices are not being transferred. And that's another thing we built into this, is to capture some of that traditional knowledge and pass it on. Because for me, I'm not Hawaiian. I've been here 30 years and I'm still learning. And it's just amazing just how complex, integrated, all the science, the traditional science that's there is really important. And that's another thing, is to really bring that to the forefront and make people understand that these traditional practices are born out of science, and they have value today, and they need to be preserved, and they need to be transferred.
Mahalo. Dr. Alika, anything to add onto that?
Yeah, just going back to your question, one about that too, like and extending from what Dr. Kasal mentioned about the ikekupuna passing on, and really not only preserved in the next generation, but actually used and applied. so that we can really make the changes that we want to see in our community for the better. And actually, one of my, just for your audience to learn about some of my background too, and it's a little bit personal, but my great-grandmother, who was she would be our family doctor. Every time we got sick, we would go to her. She would be the one to help us get through it. And there were things that she did, specifically that was really helpful for healing, that really inspired me to do the work that I'm doing in biomedical research, because there's definitely something I was so curious to learn, like, what is it about nature that, and the remedies that she was using, the allow that she was using, that was actually helping us to reduce our symptoms, cure our disease. How does it work? How do we interact? How does our bodies like interface with these natural environmental resources around us? And so one of the examples like I can share is like noni. So you've heard of noni, and I'm sure a lot of people have heard of noni juice and all of that. It's actually the fermented noni fruit that she would use for healing. And I remember her telling stories about that it can be used for cancer, against cancer. And that when I was a keiki, and I didn't know any better, I was like, what does that mean? Like, how does that work? And when I went to high school, I learned some of the tools in molecular and cell biology that could test that in the lab setting, right? And to see how does noni interact with cancer. And so we tested that question in the lab setting and was able to identify there's certain natural compounds found in the fermented noni that actually has an anti-cancer property. And it works in a specific way. And we actually started to learn more about how that's happening. And many years later, it's in the media all of a sudden, yes, noni has anti-cancer properties. What is it about? Like, can we use that information more broadly, right? People got so excited. This is all ike kupuna, stuff that we knew centuries ago that can be useful for addressing some of these health conditions that we are aware about. And like Dr. Cassell mentioned, amazing science that our kupuna practiced. So we really want to get that back, right? We want to understand how we can leverage this amazing resource. And that's just like, again, tip of the iceberg, like Dr. Cassell mentions, like there's so much more knowledge and resources our community has that can help us address the issues that we face on a day-to-day, like these higher rates of health disparities that we see in our community. So connecting it and blending the research and using the tools that we can provide in the modern biomedical sciences with clinical research and applications can help us promote some of the work that we see in our communities already happening, some of the best practices like La'olapa'au that can be used to help reduce some of these conditions, not just for cancer, but a lot of other health conditions as well. And then again, another sort of an extension of this is that we're learning about some of our origins ourselves, trying to understand, well, where are the sources of these high chronic conditions and earlier disease stage of onset is coming from? How does it all work? So my work is in epigenetics. It looks at some of the gene environment interactions. It explains the mechanisms involved in that interface because it's really important, right? So it's not just DNA as your destiny, because there's a lot of environmental factors that shape our physiology, our health, our disease trajectory. It's not just destined in our DNA. So the modifications on top of our DNA is called epigenetics. There's specific chemical modifications, and it really informs how cells utilize the DNA and what kinds of genes are expressed and how much. And that's really sensed, it's influenced by environment, and that shapes our health trajectories in the future, not just for this generation, but the next. So there's transgenerational effects of this as well. Anyway, briefly, I'll try to get to the point. The epigenome also senses our biologic age, and there's a phenomenon called epigenetic aging, and we can actually measure that at the cell and molecular level. And so we started this study by looking at the differences in biological aging in our population in Hawaii. We had 3 different populations as part of the multi-ethnic cohort study at the Cancer Center. We were able to survey individuals within the Native Hawaiian community, as well as whites and Japanese American participants within the study. And at baseline, so individuals that are around 45 to 60 years of age on average, we were able to assess where they're at in terms of their biological aging using this approach, right? This epigenetic approach. What we found, and we recently reported this past year, was that for whatever reason, Native Hawaiians have a higher biological aging. So they have accelerated biological aging than these other 2 populations. That seems to be associated with the higher rates of obesity within that population, as well as other potential health conditions. So we think that potentially this accelerated biological aging is just indicating this risk for chronic conditions that our population experiences, right? So now we're trying to understand, well, where is that coming from? And how can that be modified? Because it's not set in stone. Disease is not your destiny. That there's no epigenetic modifications are modifiable. They can be reversed. And so what we actually looked to dive in deeper into the data, and we found that and there's certain factors that can shape epigenetic aging, not just health conditions, but lifestyle factors, social factors can actually impact your epigenetic aging. And we're trying to learn more about that. In general, what we found is people who live in poor neighborhoods tend to have accelerated aging in general, independent of different ethnic groups. It's just part of the risk factor of this aging phenomenon. But when we look at Native Hawaiians, even if they're living in these poor neighborhoods, if they have access to better resources so that they can eat healthier, if they are practicing physical activity and engaging in more robust physical activity, if they have better education, typically, they actually tend to have normal aging, not accelerated epigenetic aging, even within that population. So there's some strategies that we're starting to understand now that are actually affecting our biology, and their lifestyle factors, social determinants of health factors that actually shape inform our biology, that could help us potentially reduce our risk towards chronic disease conditions. And we're starting just to see that now. And so we definitely a lot more to do. There's limitations of our approach for sure, but there's a lot more data that we need to collect. And the support from Ola Mamo with the vans just going to help us extend the study further and try to recruit participants for these types of studies so that we can learn more about what makes up health, what makes us at risk for disease, how can we identify pathways that might be affected really early before the clinical manifestation of a disease like chronic kidney disorder or heart disease or diabetes or even cancer. Can we detect that happening, that trajectory starting to happen earlier in our population? And if we can, with the tools that we have available now, with looking at epigenetics, for example, identify individuals that might be at risk for that trajectory, can we intervene earlier? And can we leverage ike kupuna to understand how we can use community practices, cultural practices alongside those interventions so that we can promote lifestyle changes that could be sustainable, that then reduces individual level risk towards those trajectories. And then the idea would be that could sustain the next generation too, because that would reduce the overall risk in the next generation to help to alleviate that concern. So we're really, I think, ultimately trying to leverage the resources that we have to be able to understand it better in our community within the community context with these types of studies. And we're looking forward to launching this Pono Health Study because we think that would be a great opportunity to learn more about it, but also to encourage the next generation of members in our community by leveraging the van to go out so they don't have to go to the university or come to my lab to even see what it looks like. It's right in their backyard. It's like right there. So they can see like what we do, how we do the clinical assessments, because we're going to be doing like EKG and spirometry measures to look at different features of your health and inform the participant right there on the spot, but as well as take some samples like buccal swabs from your cheeks. We'll be doing some blood samples, urine samples, so that we can learn about exposures and looking at epigenetics and to see how individuals might respond in a healthy trajectory or maybe need that extra support that they need to avoid the risk for chronic conditions that might appear later in their lives. So we're leveraging the resources that we're really thankful for Ola Mamo's partnership and Papa Ola Lokahi to help us to create that kind of infrastructure that we really need in our community. So then we can blend our cultural practices, ike kupuna, and these tools, these scientific tools to bear to understand the problem more comprehensively, and then inform and inspire, I hope, the next generation of young scientists that want to step into these roles and help our community in the same way and give back to our community just as I did. So I really hope that picks it up, not just to get the recruitment happening and meeting our goals in terms of getting the numbers enrolled, but then inspiring the next generation of folks from the community to carry that on and really create that systems change that we really need to see to really get back to our INA-based practices, get back to our data sovereignty, which is another aspect of the project that we're trying to work on as well. Data for us, by us, and then within our control, so that we have a say of that information, and also to leverage that information to train others in our community about what that is, and so that they can continue on and be part of that movement of promoting health in our community, wholeness of health, right? This whole integrated approach that we're hoping to be able to push forward that our community really wants, right? To have this better understanding of this integrated, holistic approach towards health, which is definitely in line with our ike kupuna, our cultural understanding of what is health to us, right? It's not just the physical health, and then it's not just at that moment in time, but it's in capturing all of the spiritual, mental, emotional, the honua around you, the whole like the environment around you. That's really important to shape our health, and taking care of the environment is just as important as taking care of our own health. And then in order to like prevent those issues from occurring in the future, so that's like more generational. So we're inviting people right now. We're about to launch the study. We're inviting our community to come in and to participate in this Pono Health Legacy Study. Again, 18 to 64 years of age is the eligibility requirements for the study right now, but we're hoping that can be expanded in the future when we get more funding. But additionally, we're going to be following people over time in the future. So it's not just this one-time snapshot, right? We can look at it, and it's the legacy of this for our future. So that's, again, work in progress, the things that we're still working on towards. But I think we've identified some of the areas of best practices that we can start to utilize the education around that to inform our community right now about approaches that might be beneficial towards health, like I mentioned earlier, about healthy nutrition and education, as well as physical activity, and then blending in with cultural practices that make it sustainable, and then also to help us to identify what are the ongoing challenges that we face so we can improve that situation, right, going forward.
Yeah, I really love this layered approach, because I'm sitting here and you're talking about your story with your grandma, and then like, oh well, hopefully by engaging closer with the community and getting the younger ones like interested in why science matters, right? Like you see you with your doing a little experimentation and like, oh, what is that? And then you tell them like why it's important. Because to me, like when I was in science, when I was young, I was like, okay, I see that, but I don't understand why it matters, right? So like having someone who's like in your community, you're like bridging like our traditional practices with like the modern angle and helping them to understand like how they could have a place in this as a profession. Because what I hear being here on the continent and amongst the mainstream society is that like Hawaiians don't have STEM. And I'm like, are you kidding me? Everything in our culture is STEM.
Yep.
So like,
exactly.
I love that you're like creating these opportunities to like, one, get at the cause of illness sooner, but also two, like getting our youth engaged early so that they can, like you said, come along and be a part of a longer term study, longer term, like malama, nurturing that creativity, curiosity, the intelligence that is already like innate within them, and just like awakening that and seeing like how it can be applied in the future, to like help solve problems as this continues, and hopefully move the direction of these statistics in a more positive way, which you're already starting to do. So
yeah, Mom, we're super excited about this too, because for a long time I've been dreaming about this. We call these vans lab on wheels, and we really wanted to be able to showcase that to the community, see what it really looks like. And my lab, although it's hidden within Manoa, is open to our community so people can see. So we do have participants in research that come through. It is a little bit challenging for their time and their schedule. But so an alternative is having we go to them, right, with the resources that we can do from the lab side, and they can see what it's like. And I come from Nanakuli, right, too. So I would have loved to see this when I was a kid. I think I was like 7 or 8 when I was able to buy like my first microscope kit. Because you cannot ask kupuna how things work. It just works, right? You just gotta trust and then like absorb all the knowledge, right? Just pakawaha hana mekalima.
Yeah, boy, sit over there, watch.
Yeah, and then you just absorb. That's what you do. That's what you're supposed to do when you're a kid. Just absorb all the ike. So at the time, though, I was so curious. I was like, how does it work? I want to learn more about that. So I purchased this microscope kit, thinking I could figure this out. I'm going to try and figure this out. And so it inspired her sort of ike that like shared freely with our community, really inspired me and as well as many others to go on these journeys and in career opportunities that you didn't really think would fit well but actually it's really needed and it fits really nicely with our community. And that's what we're trying to encourage. There's a lot of pathways to careers in health sciences that may not look like the doctor's office, like you might not used to, like the nurses or doctors or whatever. But there are these other pathways that I think are really like just as equally challenging, just as nurturing as well as inspiring, but in different approaches that I think our community really responds to, like medical diagnoses, biological sort of approaches for looking at molecular biology. That's how we screen and test for like COVID, for example, for infections. It's PCR-based analysis. It's very molecular-based. And we've actually provided that support in the community in Waianae as well to share what that looks like. So I think really there's avenues where the health sciences can look differently for different people in different careers. There's different options that would fit really well for our community. And so I would have loved to have had something like this when I was a kid growing up, to see like that coming out. The only thing we got was like these pamphlets of information, like don't smoke and avoid that kind of stuff. But we didn't get to see what a real lab looked like. So anyway,
and I think
part
Dr.
of the
Manaki Dr. Manaki is being a little bit modest because he is truly in the community and training community members how to do research. That's the important thing, because some of the things, the techniques that we use, it's not that complicated. It's just a matter of explaining it clearly. Mm-hmm. He does a great job of doing that. And some of the things that we actually built into Kuola is to have resources. So we actually support research projects within the community that are guided. There are certain criteria. They have to train a younger generation. They have to link with a scientist, so that we're exposing younger people to these different types of careers that Dr. Manake is talking about. Because oftentimes they don't get to see that, but they do get to see it as we bring these resources into the community, and they see the benefit and the power of getting the practical application of science for their own and actually applying it to their own interests. So yeah, he's being very modest, but he does a great job in doing that, and actually taking some of the cultural practice and really boiling it down to the extreme science that is important. You know, he has a project with taro where he's actually not only looking at growing the taro and how important that physical activity is important in maintaining health, but also looking at taking the poi and how a diet of the poi made from the taro that you have grown will impact your own health in an immediate way. It's just fascinating. And this is done with men in the community. It's really fascinating. And I just to put this to how we all integrate together and working with Ola Mamo, Papa Ola Lokahi, Dr. Manakea, and myself, we all work together because we're working towards a common goal, common purpose. And it's just really exciting these times, because now we're getting to have these strong resources that we can use, push out there, and get people and get kids and young adults interested in doing some of the things that we do, so we won't lose this momentum that we have right now.
Oh my gosh, yes. Like the nerd in me, so like I'm like so excited. I'm like, I wish I had this as a kid too. But I really love how the approach that you guys are taking to make it accessible. Because, for example, Dr. Monica, you talked about your lab is at UH, right? But that environment in and of itself, a university, is normally not something that we, as in general, as Hawaiians, like think of as accessible. It's like, oh, only like the toughest of our ohana reach the university system, right? Like, so then the chances of us even being exposed to that is like this. But when you go to the community and be like, no, you don't have to come over here. Like, you're already doing it. Let me just teach you how this translates to that. So then you can see how that is easily accessible to you with this ike kupuna and things that you can learn from a young age and then continue to build upon, so that they can ultimately get to where you are, Dr. Monica and Dr. Castle, and grow into these positions where you can then influence like longer term community initiatives and like the project, right? Like leave your legacy, just like our kupuna have left their legacy. And how do we help to continue that generation after generation, once again, to like uplift the well-being and health of our communities? And to do that, despite all of the environmental challenges that we're facing, that is also contributing to the diseases that is impacting our communities. So I really appreciate that.
Yeah, mahalo.
So, yeah, of course.
Yeah, I think it was really important to add one little thing. So the workforce is definitely needed. And we work with a number of different community-based organizations, a lot of them with youth, especially like my organic farms, for example, and they're encouraging the next generation to lead out and not only work on the farm and learn about the skills, but also encourage them to seek a better education in college and equip them with that so that they can have a better future for them and their families. So the whole idea about that too is that when we've worked with them, it's really difficult to see what options are out there if you can't see it yourself. Like, you don't know what's out there and like what kind of potential careers that might be that suitable, but also really resonate with the community and what you want your passion to give back. So we were able to show that with the resources from Ola Mamo. We can say like, here's what we do and here's what it looks like, and they can start doing it for themselves, right? And step into those roles. And we're hoping to encourage more of that for sure, to build up that workforce, because academic setting, university setting, different kind of environment, but we really need our kanaka here, and really to help us promote and reshape what we think is Pono. Again, going back to our Pono Legacy Study, but what we think is Pono to like really move our community forward altogether, right? And this is just one way of making that happen. And I think it's one important way too, right, with the next generation and education, and then tying that into our community and our Pono. So mahalo.
And with that said, I just want to bring it out there that Ola Mamo are hiring some positions to help assist these projects in the mobile unit. So contact us. We will be posting it on our social medias. So just in case anybody would like to or interested. And with Dr. Manakea's comments and elaborations on everything, it's funny because I used to run away from the noni when my kupuna came to give it to me because I didn't like the taste. Now I understand, you know? So I love that. But
the more powerful the odor, the more powerful the effects.
Yeah. And also here at Ola Mamo, we are taking some turns. We are setting up wellness centers to make awareness and empower and advocate the whole wellness of Native Hawaiian health, and that's the mind, body, spirit. So we did implement Hui Kako'o, which is our mental health section. Then we have Ho'oi Kaika, our fitness. And then we have Aipono, which is our nutrition, dietitian. And we did partner with different partnerships, different organizations. We partnered with a local gym. We partnered with Iola Lahui for our mental health. And then, of course, we have these two doctors and these great programs that are launching. And we're going towards the more PICO reference, ancestry, present, and descendants. So exactly what Dr. Manakale was saying, taking the information from our ancestors, teaching it, and giving it towards our descendants. Yep.
That's awesome. I love hearing about all the new programs and like the collaboration that's happening between the different organizations, because I think it's so important for us to work together. One of the observations I have seen over the years is like, I see a lot of people doing a lot of different, like separate stuff. And then like, as we know with our communities, right, like the resources are not always a lot. So we got to maximize what we get. So seeing Lahui finding those ways to work together and just maximize that impact to our community, I think is always awesome. And it's one of the reasons why I started the podcast is because I know there's so much going on and we need to leverage different communication pathways so that people know, right? Like we all know the coconut wireless and we know we have social medias, like different ways, but like different kind of, I would say, age groups within our communities, like communicate different ways, right? So our hope with the podcast is to help amplify that message and also let it be like evergreen content that people can come back and listen to and be like, oh, can I learn more about this? And what are they doing now? And deep dive on some of these things that we used to, like you said, we only see the pamphlet. But wow, the hour went by very quickly. And I can already see that, like, if you guys are open to it, I would love to do a part 2 to see, like, maybe talk some more about the results and Leah, like, talk about some of your new programs and the people that you guys are working with to raise awareness on that too, if you guys are open to that.
Yes.
Yeah, for sure. That'd be great. Thank you.
Yeah. Okay. So before we end, Dr. Monica, for those who are interested in being a part of the study, how do they enroll? Get in touch with you about
Yep.
that?
Yep. So we are just about to launch. It's not quite ready yet. We still have our website to develop, and then we're about to get our applications in order so we can start recruiting participants. So hopefully, stay tuned. I'll hope I can get some information to you, Moana, so you can pass it out and share amongst your network. That'll be really helpful for us too. And we are looking for not just we primarily residents, right, of Hawaii right now.
Okay.
So neighborhoods over here, multi-generational. We're really looking for those that are, of course, Native Hawaiian, Pacific Islander background. We're working on that age group 18 to 64, and it's like a whole. It's a lot of information that we provide too as part of the study. So it's not just we're taking samples and information. We're actually sharing a lot of data that typically you wouldn't get in a doctor's office. So it's even more comprehensive. And then we're going to be looking at the changes over time too. So it's a really unique experience, I think, for most people in our community. And I, again, really appreciate this opportunity being here to share that. And once I get more information and the flyer and the link to the website where people can start recruiting, I'll share it with you. That's forthcoming in the next month or so. Mahalo nui.
Okay, sounds good. Yeah. When you're ready, then maybe we have you back again so you can talk
Yep.
more in depth about the study and where you guys will be engaging and all that kind of stuff.
Oh, yeah, for sure. Mahalo nui.
Yeah, of course. Dr. Castle, where can people find? I put the link up for kuola.org, but maybe last words from you in terms of the project and what you're hoping to accomplish.
Thanks. Yeah. So thank you again for having me. I appreciate that. Kuola.org is where folks can go. They can actually sign up for the sessions, one of the modules if they would like. There's a phone number. It's 808-441-7710. They could call our staff and also find out more locations about where we're going to be. We will probably be in the field later this month. We're looking at some locations. We want to go up to Waianae possibly first to do some work up there and have some positive outcomes in Waianae as well as Waimanalo. So we'll probably be going there very shortly to test out our equipment and to have the vehicle put into a good application. We do have some resources where we can actually train men to go onto the internet and locate resources for the internet on themselves on a long-term basis. So we're going to be doing that. But just the short of it, kuola.org, 441-7710. Call us and they'll find out more about what we have planned.
Awesome. Mahalo nui. And Leah, Ke Ola Mamo, tell folks where they can find that and where they can find you online.
We have a website, www.keolamamo.org. You can find us on Instagram, Keola Mamo, or you can give us a call at our office. 848-8000. Sorry.
All right. 808-848-8000. All the eights for the 808.
Yeah.
All righty. Well, thank you guys. Mahalo nui so much again for being a part of our show. Dana and I will definitely be in touch again to have you guys back because you're doing such wonderful work and we cannot help but just help to amplify it because we get excited when we hear about all of the different organizations and what you guys are doing for our community. Even if we're not at home, it's to help our ohana who are still back home connect with the resources and find those things to help navigate our different health issues and needs from a very comfortable cultural safe space, which is ultimately what we want to have so that people are not scared of health and hopefully get the help that they need earlier because it's not as intimidating when you have faces and people who have the expertise. That combination I feel is super important. Please check out these wonderful health initiatives, and when the study is out, if you feel the criteria necessary, please participate because it's about your health, it's about your family's health, and it will also help our community's health. Please share, subscribe, help other people see this even on the replay, even for those who cannot join us live. The information, we definitely want that to get out. So please use your internet coconut wireless and share the information to your ohana, your friends, and family. With that said, mahalo nui again to Papa Ola Lokahi for helping to enable all of this work that we talked about tonight, and also for helping us on the podcast to be able to bring all of this to our community. So, mahalo nui. Take care, everybody. We'll talk to everybody soon. Ahui ho.
Mahalo.
Your whole
Oh, where's my outro?
So many stories left to tell, even if we have to ourselves. Can't keep history on the shelf. If they won't tell it, we will.
If this the land of the free, it was a freedom then. When they annexed Hawaii and called it cedar lands, without any type of payment and no signing off. Called themselves the Republic in 1894. 1.2 million acres overtaken from the Native Hawaiians. When they resisted, the West retaliated in violence and erasure. The Hawaiian language is banned as part of colonialism's plan to expand, yeah.
Stuck between a rock and a hard place. Multiple bombings of Kaho'olawe as a part of their ongoing war with Asia. Used it as a place for target practice. No consent or compensation. Colonizers call for annexation. No work out for all the locals. School will never let you know. So many stories left to tell, even if we have to ourselves. Can keep history on the shelf. If we won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can keep history on the shelf. If we won't tell it, we will. We will.
So if you put Hawaii into perspective, well, Black and Asian history is interconnected. Considering the fight with the Pacific, then of course, versus Asia, they was treated as a middleman for war, but didn't let the Western colorism run its course, cause dark skin was a sign of dignity to core. The land was taken in the name of capitalism, when prior to it was an actual kingdom. Clap back at the system.
Stuck between a rock and a hard place. Multiple bombings of Kaho'olawe as a part of their ongoing war with Asia. Used it as a place for target practice. No consent or compensation. Colonizers call for annexation. No work out for all the locals. School will never let you know. So many stories left to tell, even if we have to ourselves. Can keep history on the shelf. If we won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can keep history on the shelf. If we won't tell it, we will. So many stories left to tell, even if we have to ourselves. Can keep history on the shelf. If we won't tell it, we will. Too many stories left to tell, even if we have to ourselves. Can keep history on the shelf. If we won't tell it, we will.